Accessing quality mental health care remains a significant challenge, with 43% of Americans who actually need treatment unable to get it due to barriers like navigating insurance or finding the right provider. By addressing these obstacles and offering support, this solution ensures progress that allows people to receive the care they need at a cost they can afford.
Accessing mental health support can be challenging due to insurance complexities. However, a mission-driven behavioral health group is dedicated to making care accessible to all.
Rula's comprehensive care offers individual, couple, and family therapy ages 5 and up. They also offer medication management and psychiatric care. This means that no matter where you are in your mental health journey, Rula can help.
Rula is transforming behavioral health care by supporting patients through every step of their healthcare journey, from navigating insurance to providing end-to-end support.
Clients are able to be matched with the best therapist who takes their insurance, and therapists are able to have the flexibility within their schedule and find the balance within their life. We often look at therapy to have 3 parts: a beginning, a middle, and an end. Rula clients often share that it's really easy to get started. They receive rich, high-quality care, and they feel empowered to use the skills they learn in therapy in their day-to-day life.
Joining me now is the Chief Medical Officer at Rula, Dr. Doug Newton. Doug, thank you so much for being here. I am so enthusiastic about what you're doing. I believe telehealth is a future, and people have been struggling with delivering mental health through telehealth. You've solved a lot of problems. How? What have you solved?
Well, we're continuing to solve them, I'll say. But thank you for having me first and foremost.
Of course. This is so important. People are trying to solve this issue, and you're getting there.
We are. And so with Rula, what we do is we're a national company that is a national provider group. And so what does that mean? We're in 50 states. We have 13,000 therapists. We also have...
And I want to stop you periodically to highlight, this means that he has to have licensed physicians and therapists in each state. He has to understand the regulatory landscape in each state. And then each state has different insurance standards too. 100%. It's crazy.
100%. And so this is exactly what we're getting at, is we want to make sure that we solve this so that the providers themselves and the patients don't have to deal with all that. So that's our solution, is to say, listen, we're going to take you, come on in. You know, we have 50 states. We have both therapists, as you and I were talking about, psychiatry as well. We want to make sure that we're that one door, that front door, and that solution for people to come in and get the care that they need.
So if anybody's interested in getting mental health services, they should just show up.
That's right.
And you will handle the process of getting them enrolled.
We are, again, a provider group that is enabled by technology. So we use our technology platform to both help the patient as well as the provider. We get all the providers credentialed, you know, through the insurance companies. We make sure that they have we have our own medical record system, but it's also the human support, and I think that's what's important as well.
And one of the big barriers in mental health, telehealth, has been psychiatry. Let's talk about why that is so. There's a shortage of psychiatrists, which I hope we're getting closer to solving that, aren't we?
I would like to say yes.
You're a psychiatrist. You're a child
I'm a child psychiatrist by training, child and adult, and we're getting better.
Then, because there's a shortage, it's expensive.
That's right.
And then you have to use physician extenders like nurse practitioners and things. So how do you balance that out?
We want to make sure that we are providing the good care. We want to make sure that we are not just providing psychiatry, which we do have, but we do have nurse practitioners. And we do that through, again, we have a lot of quality control, we have a lot of oversights, and we have a lot of ability to support these providers in general to be able to practice. And quite frankly, one of our mottos is, let's make it easy to do the right thing.
And what's the feedback you're getting from the patients?
The patients love it. We really, you want to make sure that, again, back to agency, allowing them to have a certain level of control over their care and be able to have that conversation with their provider. They really love having that opportunity.
I'm sure. Now, in the little tape piece we saw rolling in here, they mentioned family therapy and group therapies. Tell me about that, because I really think that's another layer to the future. Is that all available through you guys?
Yeah, that's all available. And again, as a child psychiatrist, I think it's so important to be able to have not only the family therapy and couples therapy, but it's the family unit, it's the system.
Yeah, let's state that out loud, that when particularly with child and adolescent, the patient is the child family. That's your patient,
That's
not
right.
just the child.
That's right.
Yeah,
Exactly.
and people miss that. I just, hats off to you. Thank you for doing it. Keep pushing. I think Medicare maybe is coming down the line.
Yeah, we are looking at all the government pay options.
Be so huge.
Yes.
Again, this is the future. There's just no reason we shouldn't be able to do this and do it well.
100%.
Simple enough.
Absolutely.
Well, I appreciate you being here. Thank you for your
Thank
efforts.
you.
All right, to find out more, visit Rula, R-U-L-A, Rula.com. We'll be right back. Don't go away. Don't go anywhere or you'll miss this new all-natural food product line for the whole family.